Now we're going to discuss paradoxical breathing. If you recall, we did the primary breathing technique, which is the correct way of breathing. Now, before we do paradoxical breathing, get a paper bag and keep it nearby you. Paradoxical breathing can cause, much like the other form of breathing, hyperventilation, panic attacks, so on and so forth. These are normal for some people, but keep a paper bag, and if you start feeling really nuts and weird and start getting really scared and hyperventilating, then just breathe in and out of the paper bag and you'll calm down. Now, paradoxical breathing is actually very simple, but at the same time hard to do. Now, here's what I want you to do. Lie down. Breathe normally. Relax. Let your mind drift. Think about something pleasant, something to eat, getting rid of cramps, or having sex. Enjoy yourself for a few moments. These techniques do not have to be painful. Now take a few deep breaths. Now, here's what I want you to do. Instead of pulling your belly and chest up, I want you to suck your belly in and have your chest automatically pull up. You can hear the constriction in my voice as I do this. This is how you should sound. Then, at the right time, which I'll cue you in later on, I want you to flick your belly out and relax. So let's do it for real. I'll do it a number of times. You pay attention. So what I did when I heard that strange sound, that was me sucking my belly in, and as I was sucking it in, I pulled my chest up. And as I reached the top, I said, and pushed the belly out, but not in a aggressive way. Go like this now. Let's do it again. You may notice some twitching in your body. Don't be concerned about it. Now, for your first time doing it, I wouldn't do it more than 10 to 20 times. It doesn't do you any good to do more than is necessary. That just helps reinforce obsessive compulsive behavior, which is all based on fear. Obsessions and compulsions are nothing more than an attempt to control free-floating fear and free-floating anxiety. So when you see an obsessive-compulsive person, you'll recognize them immediately. They've constricted their world. That's what they've done. This technique helps break that down, so let's not reinforce it. Let's do it again. You want to remember to flick the belly. You don't want to over expand it. You do not want to be aggressive. It's very important, as we stated, first time you do it, to only do it 10 or 20 times. This is imperative until you begin to feel comfortable in doing this exercise. The first week, I suggest the following for most people. Begin with normal, regular, rhythmic breathing, as we've discussed. Do that for about 10 minutes. Then move into the paradoxical breathing. Dr. Rigardi used to call it croak, hold, and flick. He liked that name. You can call it whatever you want. This particular technique will become very useful, particularly when you learn to do it with images and situations. For an example, I'll be very quick on this, because this has to be saved for another CD. When you have a problem or an issue or something you want to explore, you will hold that in your mind's eye and begin to do croak, hold, and flick. And when you're done with the session, after you relax, write down the first thoughts that come into your mind, and that will often help you deal or resolve or understand the issues that you're dealing with. And it will also help you become creative if you're an artist. Now, the first week you do this, I would suggest doing it 3 times during the week. Monday, Wednesday, Friday. Whatever, you choose your time and place. You should be alone, preferably, and you should have the brown paper bag nearby. You have to remember, when you're doing selective brain damage, and that's a term I made up for all of this, I know a lot of people will be happy with the phrase selective brain damage. You will notice that during your normal week, you'll become more aware, particularly when you combine this with the computer technique. You'll become more aware of your personality flaws or obsessions or compulsions. Important to keep in mind is your personality is not sacred or holy. In fact, most of our personalities are really problematical. This is, again, we're challenging the OAS system, the oral, anal, sexual system. And for most of us, we believe that our normal way of behaving and our normal things that we do are the way we really are. In fact, they are not. That's the way we've become through learning, imprinting. Now, of course, some of it we know is genetic, and I won't go into a further discussion of that this time. Next time I will. That's very important. Now, the technique, what it does, it begins to break down your oral, anal, sexual obsessions, if you would, or compulsions, mannerisms, quirks, propensities, things like that, habits, if you would. And it then frees up, if you would, a part of the brain that can really make choices. You see, we only believe that we make choices. It's difficult for a person to make choices when they're a robot. They believe they make choices. They do not make choices because they cannot evaluate their entire contextual environment. They perceive selectively, they behave selectively. So therefore, they're not really making choices because they cannot see the options available to them. Croak, hold, and flick, or paradoxical breathing. After a number of months, you'll begin to realize that there's a part of your brain or a part of your consciousness that is not affected at all by any of your personality traits or habits, that sort of lives by itself. You'll begin to feel as if you can walk through words. That's a very important concept. When you hear people talk, you'll immediately see how contaminated they are. You won't be trapped by what they're saying. You'll be able to see what they're really saying, and you'll be able to walk through situations that at one time trapped you or got you hung up or got you caught up in thinking, or false thinking, if you would, or rumination, which is the most appropriate phrase. So after a month of doing this 3 times a week, 10 or 20 times, we want to move to the next step, which is trying out doing it for 15 minutes. Now that may be too much for some of you. So let's try this. After the first month of testing, and maybe even keeping some notes, let's start out by doing 10-15 minutes of regular breathing, as we discussed earlier. And let's then do 10 or 15 minutes of paradoxical breathing. And let's do that 3 times a week. If you feel you can't handle that, just simply back off to 5 minutes of paradoxical breathing. Give yourself another month. And with that, let me wish you the best of luck in this work, and rest assured that the Undoing Yourself Center will be developing more techniques in the very near future. Actually, they're already developed, but we'll always work on new things, and be providing you those on CDs through New Falcon.